Hi there. I'm coming here today from Nova Pediatrics, and I'm here. I'm gonna do a little brief talk today, and we're gonna talk about kind of the 101 on COVID-19 testing, and then we're going to talk a little bit about the safe use of hand sanitizers, since we have a lot of use of hand sanitizers recently. So for those who do not know about COVID testing, I wanted to give just a brief overview of what's out there. And keep in mind that everything I say regarding COVID testing can change hour by hour, so things may change, but this is kind of a basics on what we know right now. There are two main types of COVID testing. The first being diagnostic testing. And so diagnostic testing involves tests that you can show if someone has active coronavirus, right? So you're diagnosing, or you're actively trying to find out if that someone has coronavirus. And the reason for doing diagnostic testing, of course, is so that people are able to quarantine, right? So you want to know, does someone have the disease, so that they should be quarantining themselves, and people who they've been exposed to should also quarantine. There are two types of diagnostic testing that you'll hear about in the news. There are antigen tests that detect specific proteins on the surface of the virus, and there are molecular tests, also known, and you'll hear in the news, PCR testing, that detects the virus's actual genetic material. So first of all, the antigen tests, there are actually two rapid antigen tests approved by the FDA for EUA, which means for emergency use authorization. So the FDA, because of how coronavirus is, approved these two rapid tests that actually are done by a nasal or a throat swab, and the nasal swab being actually a more accurate version of it than just the throat swab. And these tests actually usually will come back within 15 minutes. And that sounds pretty great, right, to know. But the downside on these tests are the accuracy. So if the test comes back positive, you can be pretty reassured that it probably is a true positive. But if the test comes back negative, it may or may not be an accurate test. And so just keep in mind, some providers, some doctors will send a second test off to confirm that test if they really are worried about coronavirus. The second type of diagnostic testing are the molecular tests, and these, again, as I said, are the PCR tests. These are also performed by a nasal or a throat swab, again, the nasal test being a better test. There are also a few saliva tests, but those are still kind of initially out there and not a lot widespread as much. The downside to these molecular tests, the PCR tests, are the time that it can take to come back. So realistically, some of the labs right now, as we send these out, are really taking sometimes 7 to 10 days to come back. So unfortunately, these tests are taking a while to come back. They're not always available to be done. But the good news with these tests is they're pretty accurate. So the tests are pretty accurate. They just take a while to come back. Then you also will hear about the second type of test, is antibody tests. The antibodies test is kind of looking for antibodies by someone's immune system. So if they've had coronavirus and their body mounts a response, or when we say mount a response, means their body develops antibodies to the coronavirus, which lets us know that they've had the disease. The antibodies, though, can take several weeks or several days to weeks to come up into the system, and the antibody tests are not used to diagnose someone with active coronavirus. It's more of a if they had the coronavirus recently. And the really big concern with these antibody tests is doctors and providers really don't know how to interpret these tests. We don't know what it means to have antibodies, except that you have at some point been exposed, or you had a case maybe of coronavirus, but we don't know if that means you're immune or not. And really, we're not sure at this point immunity status if you're positive on the antibody test. The antibody test is usually a blood draw. It's a finger stick or an actual blood draw from a vein. The results can come back in 1 to 3 days. And as I said, we're not sure what to do with these results. And so many folks are actually not ordering the test because we're not sure what to do with them with a regular person. They are doing lots of studies out there to try to determine how many people in our communities have been exposed and have maybe had mild cases of coronavirus. But for a general person, we're really not sure what the test means. And so the other very interesting piece to this, and there's still, obviously, as I said, things are changing all the time, is that they believe that some people do develop these antibodies, but then they go away. So we don't know how long the antibodies last, and we don't know what this means. Does this mean that people are losing their immunity to the virus if they've had it? So really keep in mind there's still a lot of uncertainty, and the tests are not super good at this point. And so testing really is not it's a work in progress. So things are hopefully going to be improving, but that's kind of where we stand with the coronavirus testing. And so the second piece that I wanted to discuss today is on hand sanitizer. So obviously, since this pandemic started and since coronavirus has been been around and been in the news, washing hands, right, has been the really, one of the top 3 or 4 things that you can do to try to stay healthy, right, and try to prevent the spread. And so that being, obviously, ideally washing with soap and water, and they say for at least 20 seconds, is the best way for children and adults and anybody to get rid of germs, right, including COVID-19. And I actually heard something recently in a talk I listened to this week that it's not even how well you wash, but it's how frequently you wash. So if you can wash your hands frequently, 5-10 times a day at the least, then that really is how you're preventing spread. So frequent hand washing, obviously, very important. But then the question comes up, what happens if you don't have the soap and water available? And that's where hand sanitizers come in, right? And so recommendations from scientists have been to use hand sanitizers with at least 60% of alcohol, right? And so nothing obviously is without risk, right? So these hand sanitizers are made with this alcohol, and of course, we've been instructed by experts to purchase hand sanitizer and keep our hands clean and use it frequently. But that being said, there's all this hand sanitizer out there, and children are getting exposed to it, right? And children, as children do, they put things in their mouth, or they overuse it, or so we have to be very careful with our young children and with anybody overdoing with the hand sanitizer. So just to put this in perspective, since the coronavirus 19 pandemic started, the National Poison Data System has been getting many more calls about unintentional exposures to hand sanitizer. So in the first half of 2020, there were about 50% more reported cases being called to the Poison Control Center about hand sanitizer overexposure, and many of these reports were for children under age 5. So just obviously keep in mind those are our kids that may be at more risk for getting into them, not using them correctly, overusing them, putting them in their mouth, which is very worrisome. And as I said, I just want to put this in comparison. Health experts recommend using hand sanitizers with alcohol concentration between 60 to 95% to kill the virus. Now this, I just want to put this in perspective. So hand sanitizers, their alcohol content is 60 to 90%, right? Drinking alcohol that adults drink is between 5 and 40%. So really these hand sanitizers have a lot of more alcohol than what is purchased for drinking purposes, correct? So that being said, right, you do not want children to drink hand sanitizer. Obviously very dangerous for them to drink even regular alcohol that adults drink, but definitely do not want them to be drinking hand sanitizer. Swallowing, as you can imagine, swallowing just a small amount of this can poison children, right? Many of these hand sanitizers are made with, as I said, alcohol or rubbing alcohol being ethanol alcohol, isopropyl, or isopropyl alcohol. Alcohol poisoning. So what would happen, what would a child look like or someone look like if they were poisoned or drank too much of, or drank obviously even drink a little bit of these hand sanitizers. They may be more sleepy. So we get, alcohol can make people sleep in general, right? It's kind of a sedative, can make people sleep. Can cause low blood sugar, which is very scary, right? Your blood sugar can drop too low. And in that case, you could have seizures or pass out, and you can develop a coma, or it can be fatal. So obviously we have to be very cautious with hand sanitizers. The other piece to this is that methanol is also another type of alcohol that has been used in hand sanitizers. And there have been many reports that both children and adults have been poisoned by using hand sanitizers that contain methanol. And methanol is also called wood alcohol, methyl alcohol, or methylated spirits. So methanol should not be used in hand sanitizers. And I know there's been reports out in the media, and wisely so, to let people know that these products have been recalled. So any hand sanitizers that have methanol in them should be recalled. Many of these products were coming from Mexico, were imported from Mexico. So you should read your hand sanitizer's ingredients. If it has methanol, methanol, that actually that has been recalled. And methanol, similarly to ethanol, but also can cause nausea, vomiting, headache, blurred vision, blindness, very scary, seizures, coma, permanent nervous system damage, or death. So very dangerous. Methanol even more dangerous than ethanol. So obviously any hand sanitizers with methanol have been recalled. So and I'm going to discuss briefly what to do if you do have a recalled hand sanitizer. But to let you know about how to kind of prevent some of this poisoning, right? So the American Academy of Pediatrics, our parent organization as pediatricians, urges parents to keep hand sanitizers out of the reach of children, right? So that makes sense. So just be mindful of where you're storing your hand sanitizers. Don't forget about travel-sized bottles of sanitizers that you put in your purses or your diaper bags, your backpack, your cars, right? Be very careful that your young children in particular, are not getting into them, right? And potentially swallowing the hand sanitizer. So the other thing is, parents and caregivers should be supervising kids' use of it, right? Because kids sometimes, they'll put too much hand sanitizer on, right? And it's dripping almost off their hands. And as you know, young kids like to put their hands in their mouths, so essentially they're drinking it if they have excess on their hands. So be very careful with your kids even just using it. Supervise the use so they don't overuse it. The FDA began letting companies that normally do not produce hand sanitizer, they've been allowing them to produce and sell it right during this pandemic, because we wanted to get more of it out there. But you really do need to check the label. So that's why there's been extra hand sanitizer out there that may not be appropriate with the methanol in it. So when buying hand sanitizer, as I said before, please check the label and the ingredients and any warnings and precautions. Because as I said, the methanol can be much more toxic than the ethanol. So, interestingly enough, with, obviously the worrisome factor of young kids, and even that would be another talk in itself, but even older kids trying to use it as a drug, there have been talks and ways to try to prevent the abuse of it, or the use of it even. And to reduce the risk of injury from children drinking hand sanitizers, the Academy of Pediatrics has urged that companies that produce these hand sanitizers add ingredients in it to make them taste bitter, right? So if a child were to drink something and it tastes horrible, they'd stop right away, hopefully. And that's one way to kind of prevent the consumption by young children. This important step would hopefully help children from eating more of the product, right? However, there could be children who drink it, children or older children, and so we have to be very careful. You want to look, there's some hand sanitizers might on the bottle say denatured, and in that case, if it does say denatured, that's another way to make it unappealing to drink, so that would be a safer one. You can also check the label, the ingredients of the hand sanitizer for bitter ingredients, and these would be something called Bitrex, and that is denatorium benzoate, sucrose, octaacetate, or butanol, which is tert butyl alcohol. And all three of these types of ingredients make the hand sanitizer taste bitter. So any of those three ingredients would be a way to deter young kids, we hope, from drinking it. I also wanted to kind of make a note about homemade hand sanitizers, right? There have been talks about people making their own hand sanitizer because of the shortage, right? I mean, there's been a shortage because there's been such a demand that sometimes it's been hard to find. So if you have made your own hand sanitizer, you have to be very careful. It may be tempting to do this, but it may not be the best thing to do. The FDA warns that if it's made incorrectly, it may not work, right? So you have to be very careful in that sense. But there have also been reports of skin burns from naturally made hand sanitizer. So I believe it actually has gotten better. The availability of hand sanitizer is now better. But be very, very careful of making your own, because it may not work correctly and it may burn the skin. And so that's just another kind of word of caution. And as I said, I was going to talk a little bit about how to dispose of recalled products. So if you have determined that you've bought a product, a hand sanitizer that has been recalled, the recommendation is not to just flush it down the toilet or pour it down the drain, because of course that gets into the water supply, and we know it's toxic, right? These products really do need to be disposed of in hazardous waste containers if possible. I know not everything's possible, but be very careful. Please do not put it into the water supply. If you're unsure of what to do with it, you can check with your local waste management and your recycling center, because there may be a potential solution they have for you, but just please do not put it into the water supply. And some of this may be obvious, but I do want to just bring this up. What to do if you do suspect your child has been poisoned, right, by a hand sanitizer. Of course, you're going to call 911 right away if your child has collapsed, is having a seizure, hard time breathing. So those three things, right? If your child is passed out, is having any difficulty breathing, you see that chest moving very heavily up and down, or if they're having a seizure, or if you can't wake them up and you suspect that they may have swallowed hand sanitizer, right? If it's more of just that you have questions that your child may have ingested a small amount and they seem to be acting normal, you can always call the National Poison Control Center, and they're a wonderful resource. And that number is 1-800-222-1222. So they have a nice, easy to remember number. But their website is Web Poison Control, and again that number is 1-800-222-1222. So the National Poison Control is wonderful for many resources, but definitely if you suspect your child may have swallowed some hand sanitizer, maybe a small amount, and they're acting normal, obviously if it's not a 911 emergency, you can call and ask for advice. You can always call your pediatrician, but we may be calling them if it's an ingestion, because we do rely on them as a resource also. They're very helpful with anything that a child is ingested, and we want to know what to expect from that. So I hope this has been helpful. Times are every week, every day we have something changing in our environment related to COVID-19, and but I do think with everything you do need to be cautious. We want to keep washing hands. We want to wear our masks and socially distance. And I've this week I've read I read all the time about the latest stuff, scientific stuff about COVID, and I've attended different webinars. But really the single most important thing we can do is wearing our masks, because masks are really the thing that is reducing the spread of this COVID-19. Washing hands is also number 2, and tied with number 2 is socially distancing. So keeping your distance, but if you can't keep your distance, the masks really are helpful. I saw a statistic this week that if 2 people are wearing their masks and at least one of them has COVID, the risk of transmission is like 1.5%. So that's even without socially distancing. So the masks really do work. Typically a mask, that could be another talk in itself, should be kind of 3 layers of material, but masks really do work, and so that's just something I wanted to say. And we're here at Nova Pediatrics. We're here for our patients. If you have questions, please call us. Children are going back to school in some form or another, virtually or in person, this fall, and they still do need to come in for their annual physicals and receive their vaccinations. Flu vaccine will be starting in our practice in early September, so please call. We're going to be doing some flu clinics, and we are also going to be doing flu vaccine during regular visits and during the weekdays and on weekends and some weeknights, so as we do flu clinics. We will be getting that information out to our patients. And please use your pediatrician. Use us as a resource when you have questions about COVID, because we know that things are changing, and we want to be a source of information that's accurate for you and reassuring for you. So, but thank you very much, and have a good day.